Emma, for around the last decade or so, you've been taking people to Brazil for a 7 day long seminar. I'd love to know more about what this is and why you do this.
Sure. I went to Brazil the first time in 2001 because I was invited to teach there. And as a result of being there, I was exposed to Spiritism. And it's not it's different than spiritualism. It's oriented towards evolution and simply evolution rather than just the phenomena that can come up in spiritualism. So what I found out was that there are 50 psychiatric hospitals that are run by spiritists, and they do a lot of spiritual work, meaning energy work, spirit release, blessed water, things of that nature, within a psychiatric hospital as a complement to what goes on in a conventional psychiatric hospital. So not only do they have these spiritual types of treatments or energy work treatments, but they also are orienting people towards their own evolution, which doesn't usually happen in our conventional psychiatric hospitals. So I was really impressed with the whole model. And they are working with people who are in spiritual emergence, meaning spiritual awakening process, or distressed by their spiritual awakening process, and they're able to not only through medical intuition identify who is in this particular process, but they're able to help them, and help might mean provide them with free training so that they can harness their psychic abilities. So again, this can be part of the treatment that's given in a psychiatric hospital. And these kinds of things are also included in the Spiritist community centers. And within those centers, there's also training to be an energy worker, as well as training to be a medical intuitive. And again, this is part of Spiritism. And in the community centers, it's all offered for free. And I like to think that as more health providers, healthcare providers from all over the world get exposed to this particular paradigm, that they can come back from Brazil, come back from the seminar, and bring some of what they've learned to their own private practice or into the hospitals where they work or into their communities. So I've been really excited by what I've seen there, and I've been excited by the effectiveness of the kind of work that's being done there, and I would like to see more of that paradigm coming into our communities outside of Brazil. And that's why I lead the seminar and have been doing it ever since 2015, more or less. And the people who come and take the seminar say that it's been transformative. So it's been just continually exciting for me. Thanks for asking.
Sure. And I'd love to ask as well, so who comes to these seminars? Is it just healthcare professionals? Is it no?
It's healthcare providers, so that might mean psychiatrists, nurses, psychotherapists, psychologists, and some people who are real change agents in mental health care. So they're not necessarily licensed as healthcare providers, but they are movers and shakers in their community, creating change.
Thank you so much.
Mhm. You're
And if
welcome.
anyone is interested in attending or learning more about this work, where could they find out more information?
If they go to IMHU, so .org, and then look under the tab for professionals or healthcare providers, then they can get more information about the seminar in Brazil. Okay.